Nowadays, people are living longer and longer. Benign prostatic hyperplasia is a condition that occurs as men age and get older. Generally, it starts in men over 40 years old. There will be signs of prostate tissue enlargement, but not everyone with this condition will experience symptoms. Only a small portion of them will actually have symptoms. However, if we live long enough, 80% will develop an enlarged prostate. Basically, every man can develop this condition as they age. Symptoms are generally divided into two parts. In the early stages, when it's not too severe, they aren't necessarily related to the size. Symptoms can occur regardless of the size. Early signs include frequent urination, difficulty holding it in, or feeling like the bladder isn't empty. As it progresses, the urine flow may slow down. We can categorize these into two main types. They are called dynamic obstruction and static obstruction. Dynamic obstruction means that even if the enlargement is small, the symptoms can be 10 times more severe. As for static obstruction, the symptoms are usually related to the size. For example, a 50-gram enlargement will cause symptoms proportional to that size because it compresses the urethra. Treatment for an enlarged prostate ranges from conservative approaches like watchful waiting and adjusting fluid intake. For instance, if you wake up often at night, try drinking less water. During the day, you might reduce tea, coffee, or soft drinks. If these don't help, the second step is medication. However, medications can have side effects. Most medications are divided into two main groups. The first group affects the autonomic nervous system. These can cause nasal congestion, cold-like symptoms, allergies, or even low blood pressure. The other group of medications interferes with hormones, reducing male hormones to shrink the prostate. But the most important thing is that you have to take them every single day. When it comes to surgical treatment, there are 2 or 3 main options available. The standard treatment involves using an endoscope to go in and scrape away the prostate tissue. However, this method is most suitable for very large prostates. While it's an effective cure, it comes with many potential complications. On average, patients need to stay in the hospital for 3 to 4 days, and it can cause retrograde ejaculation. This can occur in up to 90% of cases. Instead of flowing out, the semen flows back into the bladder and is later expelled with urine. It may also cause erectile dysfunction. Another option, which is an alternative standard, is laser therapy. This results in less blood loss, a shorter hospital stay, and faster recovery. However, it can still cause erectile dysfunction, and the condition of retrograde ejaculation, as we call it, can still occur with this method. Nowadays, surgery is becoming less popular, especially in Western countries. They often opt for procedures that involve blocking blood vessels to cause the prostate to shrink. Other methods use heat to kill the cells, allowing the body to clear them away naturally. These include the use of steam, microwaves, or ultrasound. The results are still somewhat uncertain. After the procedure, a urinary catheter must remain in place for about 7 days on average, and the full results take about 3 months to be fully effective. Currently, there is a new treatment method that has been introduced, which hasn't been in Thailand for very long. But abroad, it has been around for quite a while. This is the method they call UroLift. UroLift is a procedure where we use a needle to place a small implant into the prostate gland. We know that the prostate gland surrounds the urethra. When it's enlarged, it compresses the urethra, making it difficult to urinate. This method involves inserting the implants to pull the prostate tissue back and hold it together. Simply put, it's like pulling and tightening it. The opening will clear immediately. The advantage of this method is that there's no hospital stay required and recovery is fast. And it's suitable for patients with many underlying conditions such as diabetes or heart disease. Standard surgery requires stopping blood thinners for a long time. With this, the break is short and no catheter is needed. 80% of patients don't need one and can return to work right away. If a catheter is needed, which is about 20% of cases, it's only for a day or two. Once removed, you can work. It's permanent. One limitation of UroLift is if the prostate is excessively large. It can be done, but the results might not be as good, and we might need to use more implants. Generally, we limit the prostate size to no more than 80 grams for the best results. For patients with an enlarged prostate or urinary obstruction, Vimut Hospital has doctor's team and modern equipment ready to provide care and advice to all patients.